Some years ago, when you became editor-in-chief of Cancer Research, you wrote that we could begin to use the word cure without trepidation and with substantial hope that our science will deliver this promise. What makes you so confident that we will find a cure for cancer, all the cancers, all part of the cancers?
Yeah. So you asked, why did I use the word cure at the time when, as a physician, an oncologist, we usually stay away from the word cure for many years. I think that as we celebrate today the 20+2 genome project here in Sao Paulo, I think that the genome project has provided the roadmap, if you will, for cancer biology and cancer medicine. And the evolution of what we've learned over the last several decades has been tremendous. New drugs have been made from the Genome Project. We now know, I used to take care of patients with chronic myelogenous leukemia where we didn't have very good therapy. Now you can take a pill and people, not quite cure, but they can live with the disease, right? And then over the last 5 to 10 years, we witness immuno-oncology where immunotherapy has really, I think we can use the word cure, where deploying our immune system to really fight against cancer. And now that is a revolution that everyone now is focusing on from all different fields, whether chemotherapy, radiotherapy, or surgery actually can activate the immune system. So this is, I think what we're going to witness in the next decade is that we're going to start curing more and more patients. And we hope, as I always say, the aspiration is we put ourselves out of business. So that's why I have a very enthusiastic and positive outlook.
So in terms of prevention and treatment, do you believe that the future will be cancer-free? Can we think about a future cancer-free?
Yeah, I think that we can envision a cancer-free, and I would define cancer-free as cancers that alter people's lives. So we all are born with a genome that's going to have mistakes. And so early detection, by using the latest tool, for example, liquid biopsy, taking your blood, for example, we will detect things early enough so that we can have it cancer-free, meaning we intercept before cancer could develop, right? So in that sense, I think we will have a cancer-free world in the foreseeable future because of all the technologies, again, from the Genome Project, to be able to detect cancer very, very early. Now there are companies that are basically providing this now just to detect cancers very early. And I think this whole area is going to evolve in the next 5 to 10 years to the point where, instead of going to your doctor for a regular checkup, you get a blood sample and you're called back in. There's a signal here. We need to trace down where the cancer is, and let's get rid of it now.
Which are nowadays what do you see are the next challenges to be faced in cancer research?
Yeah, I think I look at it as opportunities. I mean, you can talk about challenge in terms of questions we want to answer. I think there are a number of areas, right? We still don't quite understand immuno-oncology that well, why some patients respond very well and others don't respond. So we really need to move the needle there. I think one area of great opportunity is really to understand not only our genome, but really the role of the microbiome. So this is where bacteria and viruses and fungus actually plays a role. I mean, they're intimately part of us. Right? In fact, if you go into the studies, there are many more of them than us, but really, if you think about it, they're all us, really. It's just that we think it is not part of us, but in fact, our health depends on the microbiome. So I think this is an opportunity again, and as you'll see in the next decade, there'll be more and more studies that's going to identify what is it about these organisms that we can manipulate for health, to prevent cancer or to even treat cancer, to get more cancer to respond. Some of the most remarkable thing that I would say 20 years ago, I probably, if I had read in the science literature now, I would think that it's science fiction. For example, how is it possible that you provide immunotherapy to patients who respond and don't respond, and you do stool transplant from those who respond to those who don't respond, and they now respond? I mean, that's really, that's a literature of fiction, 20 years ago, but this is reality now. This is an area that is really there, the fruit to be picked over the next decade. There are many more things. For example, what about diet? And how does our diet affect cancer development or treatment? And again, it may play a role with the microbiome. What we eat, how the bacteria actually will metabolize many of the chemicals we have, and how does it affect? Does it make it more inflammatory or anti-cancer? We need to understand all this, and then hopefully from a public health, we actually can start advising people, in addition to stop smoking, you can eat this kind of food.
How did your work on tumor cells metabolism has helped to fight cancer so far, and what issues are you addressing nowadays?
Yeah. So back in the late 1990s, we found a link between cancer gene and metabolism. That's what got us into cancer metabolism. I would say the challenge over the last 20 years is really finding the sweet spot of how can we basically target metabolism to cause tumors to regress but not harm the body, right? Because all of our cells use metabolic pathways. I think the lessons we've learned over the last 5 to 10 years is that we need to target whatever the target is, that it will harm the cancer cells but spare our immune system. So this whole area of immunometabolism is emerging out of cancer metabolism. So we're now focusing quite a bit on what are the opportunities. And just an example of how diet could really influence immunometabolism. A colleague of mine, we published this paper this year showing that choline in your diet can be converted to a chemical by the bacteria in your gut, and this chemical gets converted further to another chemical in the liver, which activates your immune system, so that now if you treat in an animal setting with immunotherapy, you get a much better response because you're creating a more inflammatory response. So these, and that's all through metabolism as well, but now we're including the microbiome. And then there are companies that have emerged out of the initial landscape that we established. One in particular is the drug for IDH mutations for acute myelogenous leukemia. Again, now this is FDA approved. It's a metabolic drug, and people are responding to this, providing them with, a longer survival. So these are some advances. Still a lot of challenge right now to really find other drug opportunities. So that's where we're continuing to be focusing on.
Why is it so difficult to find some drugs that act on cancer cells but not on the organism,
Right.
Normal cells?
Right. So as I said, metabolism is used by all of our cells. The question is,
Cancer and
cancer. So the question is whether the cancer cells are more vulnerable to certain metabolic pathways than, say, our T cells that fights against the cancer, right? So there's one angle to this that's based on some of the studies we've done on glutamine metabolism that some cancer cells really rely on. It turns out that inhibiting that pathway in the cancer cells actually stimulate the immune system. So that might be a sweet spot. There's a company now that's developing a drug that's in phase 1 studies based on this concept. And we'll see what happens in the clinical studies. We hope this is one sweet spot, but maybe it's not the only one. So,
because everything on cancer is not just one thing. We don't have a silver bullet.
yeah. Yeah.
We have tried many silver bullets to attack cancer because there are so many different diseases.
Yes. No, you're absolutely right. If you think about it, I mean, the public usually think cancer is cancer, but cancer is really a disease of over 100, 200 types of different diseases. And as you know, even with targeted therapy, when you have a drug against a kinase, it's only going to work in certain cancers, but only a subset of cancer that has that mutation. Right? So again, we're dealing with this level of complexity. But what we hope in cancer research is that we can boil it down to some simple principles that we can exploit that can cross among multiple different types of cancer. Immunotherapy is one area that's proven to really, work in multiple different cancers, not just one. I believe and hope that the microbiome might be another opportunity to really cross between, not quite silver bullets, but what we need is a cassette of multiple silver bullets, and we'll get there. And I think prevention, as I mentioned before, is going to be a great area to really focus on in terms of public health to make this world cancer-free.
I understand you have been to ICESP yesterday, the São Paulo Institute, Cancer Institute.
Yes.
What can you say about cancer research in Brazil? How do you think Brazil can contribute to these challenges that you have mentioned?
Right. So I was extremely impressed that a public hospital for cancer, the Institute, has research embedded and a very high level of research embedded into this hospital. And in addition to that, you also have a clinical trials unit that look at innovative clinical trials in phase 1 to deliver to patients. And what I saw is that the cleverness of Brazilian scientists is really to exploit what you do best. And this is also illustrated by the Genome project that now we're celebrating. So I think the opportunity being focused on very specific problems, which the group is doing, is going to be key, because you can move the needle by focusing on several key important areas. And this is what I see at the Institute, where I'd love to just follow to see the impact, which I know will come along. As in all places, if one has more resources with very talented people, you can make more impact. And I can only speak to the government here is that research is important. As I say in the US, invest more and you'll get more return on your investment.
I would like to come back to something that I had forgotten. You were also a proponent of chronotherapy. Could you tell us a little bit what it is and what's the evidence to support it?
Right. So chronotherapy is something that's been around for a couple of decades now, where, as you know, we have this wake and sleep cycle because of the solar cycle of day and night. And it turns out that our cells, many of our cells, if not almost all of them, have molecular clocks that synchronize the individual cells with our daily activities. So when we sleep, the cells rest. When we're awake, they're active. It turns out some of the clues that the circadian rhythm actually is important for health is that if you look at studies of people who work at night shift, and this is studies that have been done over tens of thousands of individuals that have night shift versus day shift, especially for women, a nursing study. And what you find is that the people who have the night shift actually have a higher risk for breast cancer. So the question is why? The reason we think is that the dysynchrony between your sleep and wake cycle and how your cells have an internal clock, if they are dysynchronous, then you create this chaos, if you will, where you start seeing more inflammation, and that could help trigger cancer, because we know inflammation can contribute to that. And then some of the key experiments have been done that is fascinating, which is if you take mice and you literally just switch their food from night to day, and they're more active at night. Even with the same calories, the animals that eat their food at the wrong time, they actually get more obese. Okay? And this is with the same calories. We always think that if you have the same calorie, how is it possible that with the same calories that one would get more obese? Well, it just teaches us that the circadian clock is important. So then it comes back to this whole question, what is chronotherapy? So the belief is that our normal cells undergo regulated circadian rhythms, so active and inactive. And it's believed that cancer cells may have lost the clock, so they're desynchronized. So for example, if you look in the literature, if you get radiotherapy, so radiation therapy for cancer, it turns out that patients who gets treated in the afternoon fare less well than those that are treated in the morning. And the main reason for that, it is thought, is that when you're treated in the afternoon, you get good responses, but you get less side effects because your normal cells are less sensitive, are more sensitive to radiation, right? So there's this window of side effects. The same thing with chronotherapy using drugs. There's a clinical trial that suggests that for colon cancer, if you give a certain type of chemotherapy in the morning versus afternoon, you also see a benefit. And I think this is more about sparing normal tissues from the side effects of the therapy than the cancer cells being vulnerable, because the ideal with the cancer cells are always vulnerable, but when can you spare the normal tissue from the side effects? Believe it or not, this was also reported recently for immunotherapy, where those patients who received the morning or afternoon, they actually have different outcomes, and that's very interesting, and why that's the case is not completely understood yet, right? There's something about your immune system that we know do behave very differently in the morning than in the afternoon. So those are examples of chronotherapy.
Is there a best time to treat? It's always in the afternoon, or it depends on the treatment?
It depends on the treatment,
Okay.
and it depends on the tumor, because there are certain cancers that actually will retain their clock. So we really need to understand this whole area a lot better, which tumors don't and which tumors do, and those tumors that do, maybe we can use the trick of their clock to move them to be able to kill the tumors off.
And at your lab, you are studying
Yes.
these clocks in different tumors.
Yes, this is an area of interest we have right now, because I like areas that are not crowded, because there are not very many people working in this right at the moment.
And you are studying this in animal models?
In animal models. And then I'm hoping to actually take into humans as quickly as possible now that I'm part of the Johns Hopkins Cancer Center and working with clinical colleagues. So.
You have mentioned many lifestyle factors related to cancer, like diet,
Right.
sleep time, and so on. Do you think they are so as important as genetics to the cancer development?
Yeah, I think unless you're talking about germline mutations, so there are certain mutations that if you're born with, you're more predisposed to cancer, like BRCA, right? If you don't have that, then the genetics of cancer, one group of thought is that you're unlucky. You have to have mutations that accumulate, and then you get cancers, right? But even in that background, it is all the environmental effects that clearly plays a role, because there have been studies in the US where if you use zip codes, that is areas of where you live, and depending on where you live, your rate of cancer is going to be higher because of environmental exposure, right? So clearly there's much more room to really understand how, environment, pollutants, or diet, or secondary smoking, if you will, all contribute to cancer risks. So absolutely, these are areas that we can understand more and try to mitigate, the burden of cancer.
I have a curiosity. What fascinates you in cancer research?
So, so one of the things that I always think, so I used to take care of patients, and I have to say that I've been lucky with some patients who have undergone complete remission. I still get a Christmas card every year from 17 years ago with this patient who always write and thank me for treating her for lymphoma. But then I've lost patients, and I've lost people in my family to cancer. And so, one of the challenging thoughts I have almost daily is that if you look collectively, we have such great intellect. I mean, really great intellect around the world to tackle cancer. And as you mentioned before, it's not one disease, it's hundreds of diseases. So what fascinates me is that how we can use our intellect to take a complex problem, boil it down to enough simplicity that we can make a difference to people's lives. And every day I try to think of different things, right? I mean, we can always do more of the same, but really we need to just be imaginative and say, maybe this is a missing link. And that's why I got into circadian rhythm or more work on diet, for example, things that, maybe seem to be on the periphery, but we need to understand all these factors and try to move the needle. I'm also fascinated that, over the last number of years is that the microbes play a big role in our health. And I think that's going to be a great goldmine to really explore. And, our work is starting to slowly get into that as well, looking at microbial metabolism.
If a Brazilian student came for you to advise, what area would you recommend him to or she to study regarding cancer research?
Right. So I think my advice, first and foremost, would be figure out what your passion is, right? What's driving you? And that's going to be the big factor really for success is the passion. And secondly, I would advise students to really understand the literature. What are some of the questions that have not been answered yet that might be the missing link that you can make a big difference in? It's okay to do some incremental stuff when you're training. When you go out on your own, find the question through the literature, understand the literature, where the gaps are, and try to fill those gaps, right? So I would say explore areas that are just emerging or areas people haven't thought about. And maybe at start, you don't want to risk your career on just going down that road only. You need to do some things that are more fundamental, right? But to really change the trajectory of cancer research, you need to go on the side. And perhaps I really believe in interdisciplinary research. For example, it would be lovely to see a bioengineer coming into the cancer field. What is it that the way the bioengineers think about problems can help solve the cancer problem? So no specific field, it's more the strategy of how to do cancer research rather than picking a specific field.
I think we are running out of time.
Okay.
So just to finish, FAPESP and Ludwig Institute have made a great contribution to science with the cancer genome. Do you believe that a similar partnership could be possible in the future? Which area can you think?
Yeah, as you mentioned, FAPESP and Ludwig have really made an impact, not only here, but around the world with the transcriptome analysis of cancer, for example. I look forward to really continue partnership. I think that having ideas from different corners of the world is very important. No one place is going to solve big problem. So if we can work together to really solve some key problems and really have a way to do that, and we're in discussion of those possibilities and exploring them.
Can you give some spoiler of which are the key problems, for instance?
Well, I would say that, here in Sao Paulo, for example, infectious disease has always been a big thing in Brazil in particular. And I know there are people working on the microbiome. Could that be a connection between microbial science, cancer, and also immunology, right? So we can think together, and maybe we don't go to that scale, but perhaps we can start with, fellows or students or trainees that can work on combined projects together and explore the space of where the opportunities really are and the willingness, and then we can perhaps commit to a big project.
That's it.
Okay.
So,
Yeah.
Thank you very much.
thank you.